Hi, I'm Dr. Craig Castanet again. I'm going to show you what I mean on an MRI scan about compression being the source of pain. So let's pan over to an MRI scan as an example. Look over here for a moment if you would. Marianne, are you in on this lumbar MRI scan? Okay. So this is the lumbar spine. These are the vertebrae. There's the sacrum at the bottom. That's L5, the fifth lumbar vertebra. There's L4, L3, L2, L1, T12, T11. This is the person's back here. This is their front here. This space back here behind the vertebrae and the discs in between the vertebrae, this space right here is the canal, neural canal or spinal canal. The spinal cord ends right there. You can see that gray stripe ends right there. Beyond that, these little lines are nerve roots, individual nerve roots coming down the neural canal. Look at this disc down here at the bottom, L5S1 disc. Between L5 and S1, that is very thin and compressed. There's a little bit of a bulge sticking out there as well. So the joints back here then would be compressed as a result of the loss of disc height here. You can see the bones responding with edema or swelling or water in it right there because of the undue pressure on the bone itself. This causes a stasis or a lack of circulation between the bones, which is important. So this could be a source of pain conceivably. The joints could back here also, because if this space isn't up and it's compressed, then there's more pressure on the joints back there, which could cause pain. This disc above that doesn't look compressed like this one, and the rest of them look reasonably good. However, if you look right there, and I'm going to switch now to different slices. If I go to that slice right there, you can see there's some ligamentous tissue right there that makes the canal more narrow at that point. You can also see right there the little bit of disc bulge right there at L5S1. This is the L4-5 disc. It's bulging out a little bit back there, but then there's this greater mass of soft tissue that's dark in color also. That is the yellow ligament. That's the color it is in reality. On here it looks dark in color. So that's narrowing the canal at that level. Not so much in this slice, but in that slice. In any case, I don't see a lot of degenerative changes in this spine, but I do see some significant degenerative change here that has made this disc much thinner than it should be. It should be similar to that in terms of the height. So that's been compressed and has gotten compressed over the course of decades. This gentleman has low back pain, and it goes down both legs because it's pinching nerves as it comes down here. This disc is not as compressed, but there is a little bit of a bulge that you can appreciate in that particular slice sticking out right there. That can hit the nerves. And again, I don't mean to be redundant, but this tissue right there is ligamentous tissue that's sticking out in the canal, so it's hard for nerves to pass all the way down here to get where they need to go. So that's the source of compression. Discs themselves can collapse. They can be a source of pain. They can then also, if they collapse, put more pressure on the bones. The bones can then be a source of pain, both in the vertebral body here, which can become edematous, and in the joints back here, which are meant to bear less weight, but are made to bear more weight when the discs degenerate and collapse like that. There can also be compression of nerve roots as the nerves try to get down the canal and can be compressed here by the disc or back here by ligamentous tissue. This is why people hurt 98% of the time. The other 2% of the time, it may arise from, as I said earlier, infrequent things like instability, tumors, infections, fractures, dislocations, those sorts of things. But the bulk of back and neck pain comes from this phenomenon of compression. That's what life does to us. Life is a compressing event for the spine, and if you want the most effective, quick treatment for most back and neck pain, you've got to decompress the spine. We offer the most effective and sophisticated means for that purpose. We're here in the Atlanta metro area, right at 285 and the La Vista exit. I hope you'll come see us when you have neck or back problems. Thanks.